Hey nursing geeks, it's Jay, and today I'm going to be teaching you guys, I'm going to be demonstrating the wet to dry dressing change, also known as the sterile dressing change, checkoff for Mercy College of Ohio. So just a disclaimer, as I always say or stay in the comments down below, or the description of the video, that I'm a nursing student. I'm not a licensed nurse, so please take everything with a grain of salt. I'm only doing what the checklist has been telling us to do. Right, so without further ado, let's go ahead and get started. Hello, Mr. Antha. My name's Jay. I'm a nursing student from Mercy College of Ohio. Can you please tell me what your name and date of birth is? Right, washing my hands. I sanitized when I came in. Alright, Sam Antha, December 4th, 1962. Alright, thank you, Mr. Antha. Let me go pull up your medical orders real quick. Alright, so I'm checking medical orders. I'm making sure that he does have a sterile dressing change, a wet to dry dressing change, noting that we're using hydrogen peroxide today. That's what the doctor ordered. Right, so I'm here to perform a wet to dry dressing change. So I'm changing that little bandage that's on your abdomen from your surgery. So is that alright with you, Mr. Antha? Alright, you can go ahead and assist me with this procedure by just laying still and keeping your hands away from the incision so I can work, alright? Do you have any questions for me before we begin? Alright, so now I'm going to go ahead and assess the patient's level of comfort. So, Mr. Antha, do you have any pain right now? Alright, on a scale of 1 to 10, how would you rate that pain? Alright, and how are you feeling? Alright, so I'd go ahead and medicate 30 minutes prior to the dressing change. So it's been about 30 minutes, so now I'm going to go ahead and don clean gloves, get the area set up. Alright, so I'm going to go ahead, grab my container of antibacterial wipes. Right, going to take them out. Right, now I'm going to go ahead and get this out of my way. Right, so now I'm going to take my gloves off, wash my hands. Alrighty, now I'm going to go ahead and get my supplies set up. So I'm going to grab my bin or my little bath basin I should have the solution ordered. I like 2 packs of sterile Contip applicators. I always keep at least 2 on me just in case, but 2 extra. My sterile gloves. Whoop. My abdominal pad. That's not sterile right now, but should be. So my 2 4x4s and my Kerlix. So I'm going to go ahead, only get 1 Kerlix for this because I don't want to wet all of them. Alright, so my Kerlix. Gonna get my biohazard bag. This is my little, what's it called? Sample for lab that I'm gonna take. Tape, and in the lab they will provide a little measurement ruler. That's what it's called. Alrighty. So I already got that. So I'm just gonna get my sterile stuff and solutions out of the way first. So all I'm gonna need for this first part is going to be my Contip applicators. Don't need my tape, my biohazard bag, and the wound sample swab. Alright, so I'm going to go ahead and get my biohazard bag. I like between the legs because it's kind of supported or on the other side of the patient. So I'm getting my table. It would be over the bed, but I can't do that with this, so I'm just going to have it right here. Alright, Mr. Antha. Going to go ahead, drape the patient before putting on the gloves because I don't want to get the gloves unnecessarily dirty. So I'm only going to pull this up because I don't want to overexpose my patient. So I'm only exposing the wound and only exposing what I need. If he was cold or uncomfortable, I get a back blanket, put it over him. Alright, Mr. Antha, I'm going to go ahead and take off your old dressings, alright? And I like to have my trash can right down here just in case, but I'm not putting my biohazards in there. My biohazards are going in my Kroger bag. Right, so I'm donning cleaning gloves. This is not sterile taken out, but I do want to be careful. Alright, so I saw the last person's initials, JS, so J Sellers, and the last time they put it on is 9. That's illegible, so I don't know when the last time that was. Right, so now I'm going to go ahead and take this off. I'm going to be pushing down the skin, making sure I'm taking it off nice and separating it from the skin. I'm not taking the skin off with it, so you support the skin. You take it off layer by layer. Alright, gonna note the drainage. Alright, so the drainage is, on this is Ceres. So Ceres is a light yellow / clear on it. Right, this is a little pink and red, a little clear and yellow, so that's going to be Ceres sanguinis, which is a little white, bloody, a little bloody and pink. Next is going to be, I'm taking this out, and this is, I would say this is sanguinis right here, because this is a lot of blood. I'm sorry, this is sanguinis right here. So, it has a lot of blood on it, so I'd note that, and then purulent is if it's just like thick yellow, that's a sign of infection. So know your different types of drainage. Right, so now I'm going to look at it. The wound looks well approximated. So it is inferior to the umbilicus. It is midline. The edges around the edges of the wound are red, so they're so there's some erythema, and wound looks deep. I don't see any darkening around the area, so I don't see any narcosis. And skin around. So now I'm going to go ahead and measure. I'm going to take one of my sterile cotton tip applicators. Right, the other one's sterile right there. Right, so I'm going to take this. I'm going to go down. You can, this is first is for measurement, but what I like to do first is I can go ahead and check for tunneling, so I don't have to go back with my other one. I'm going to go ahead and check for tunneling or undermining. I don't feel any tunneling or undermining in here. Right, somewhere around here, I'm not going to take it out because I won't be able to place it back in as soon as I take it out. Right, so I'm going to go down, use my thing to measure. I'm measuring in centimeters. Right, that's about 3 centimeters in depth. Going to measure the length. Length is about 11 centimeters. Across. Right, and across that is going to be about 3 centimeters as well. Good, dispose of that one. Right, good thing that's not sterile because I would have contaminated myself, but this is clean right here. And if I forgot to check undermining, I could use my other cotton tip applicator to go ahead and check for that. But I'm not going to because I don't need it. Alright, so now I'd state that I'm going to irrigate the wound prior to collecting a lab culture. So I use a water bottle, and but this is similar to, and 2 cotton tip applicators, but this is similar to what we're going to be provided, but a little bit different. So first you're going to take the cap off of the bottle thing, and you're just going to have this in here. So what I'm going to do is take this out, leave the container hold, so top to bottom. So I'm going to go from the top, make sure I don't touch anything because the tips of these are sterile. So I'm going to go, make sure it doesn't touch the edge of the wound, top to bottom. I'm going to stir around in there, make sure I get a good culture. Alright, take it out, don't touch anything. Alright, make sure you go inside without touching the outside of the bottle. Screw the cap on. Then at the bottom you're going to squeeze. Alright, that should kind of freeze the sample. There's some chemicals down there that should freeze the sample. So then I'd have a smaller biohazard bag, not the one that I'm disposing my stuff in. Smaller biohazard bag, putting that in there, and I'd put it away. So I'm saying that to lab later. Alright, so now I'm going to go ahead, take self-correction. Before I took these gloves off, if I accidentally did this, just throw in the trash can, then I'd say I'd dispose of my biohazard bag. So I'm disposing of this in biohazard waste. So, say you're disposing it, biohazard waste. I still had this glove on, so it was okay. If not, I would have donned other gloves. Alright, so now I'm going to take this one off. So now I'm going to go ahead and start prepping my sterile field. Alright, so what I like to do first is I don't need this, need my content applicators. I'm going to get everything out of the way that I don't need. So first, my Curlex fluff, put that closest to the bed. Whoop. Good thing I didn't open these. So they're still sterile. My content applicators I'm going to put slightly to the side of that. Next, I'm going to put my non-woven, my 4x4s. Then I'm going to put my abdominal pad. And I like to put my solution at the end. And I like my tape at the end. And then my sterile gloves I'm going to have over here at the end as well. So, right after I take my gloves off, wash my hands. Now I'm going to go ahead and start setting up. So first thing, I'm going to go ahead, check my solution, make sure it's a doctor-ordered solution. Right, before I do that, I'm going to open this one. Sterile Plus sponges. Gonna open my contact applicators first, because I don't want to accidentally reach over those. That's the thing, go do that. Make sure you start your tape at the beginning. Keep it away, don't look over it. Yeah, that's a good thing to start your tape before you start your skill. Like, fold it over the top so you're not wasting time doing this. Right, so I'm not touching the inside, I'm not going over. Taping this to one of the pull down parts right here. Whoop. And I'm taping this to the side of my table. It's really hard right here. Normally I do it right here because it'd be higher, but I can't. So I'm gonna have to be very careful when reaching. I'm gonna have to go from the side. So for here, for later, I'm gonna bend my tape over a little bit so I have a starting point for next time when I need it. Now, I'm gonna be very careful. I'm gonna open my Curlex fluff away from me, not reaching over my sterile applicators. Alright. I'm not, make sure that doesn't go over and back. Alright, and you can open the rest of them. I wait, because if your sterile solution splashes over, then that's contaminated. So, you'd be very careful with that. So now, I'm going to go ahead and check to make sure this is the doctor-ordered solution. Right, so I checked it. I have hydrogen peroxide. It's going to be like sterile saline, like sodium chloride, but hydrogen peroxide. So I'd look, make sure that it's clear, because it would be an opaque container, not an opaque container, a clear container, transparent. You can see it. Make sure there's no floaties. Note the color. Prescribed, make sure it's not expired. It's good for 24 hours. Right, so now that's good. I'm gonna palm the label. So make sure you get the label in your hand, because you don't want to smear it. I'm gonna cap the lid, hold it open. I'm gonna lip the container, so just pour a tad bit out over the trash can. Right, I lipped the container. So now I'm going to go ahead, just go over my Curlex. Right, and wet my Curlex, step back, screw the lid on, get this out of my way. Right, so now that the Curlex is wet, I'm going to go ahead and gonna touch the outside right over here, move that away. Alright. Now I'm gonna open my non-woven, my 4x4s, open them away from me. Alright, now I'm gonna use the inch that I have, the blue part, move it back. Now my abdominal pads, open it away from me. Move it back. right? And my tape, can move it somewhere that doesn't need, I just put it in my pocket or put it somewhere. So I'm gonna put it over here in the basin for later. Right, now my sterile gloves right here, gonna do it at the end because I don't want to accidentally cross over. Just gonna open. Right, so first thing, step back. This is why I took my watch off, because it can easily get stuck. Now I'm going to do the swoop method. Locate my thumb, step back so I'm not crossing over any sterile field. Alright, hands up above the waist. Right, so now I can disregard that sterile field right there since I'm not using it. So, next, going to go ahead and prep my Kerlix fluff. So only crossing over what I need to. Gonna get my Kerlix fluff. Get that out, make sure it doesn't run over anything. Alright, now I'm gonna wring it out. Alright, and now I'm going to step back and prep my Kerlix fluff. So I'm going to unravel it. Make sure it doesn't hit my forearms or anything. Right, I like to straighten my edges. Then go ahead and make sure it does go below the waist. Go down. Don't want to make it too thin. Kind of loosen down those edges right there. The small strands. Gets thicker in the middle. All right. All right, so now I'm gonna come in from the side, get one with the sterile applicator, right? And making sure my sterile field is still in my peripheral vision. If I need to adjust, I'd use my foot. But peripheral vision, right? Now I'm gonna go ahead, gonna wet my contact applicator because it's better wet to wet than wet to dry. Wait each a little bit, right? So now I'm gonna go ahead and put it in. Be careful not to hit the sides of the wound. Alright, so there was a sterile break right there. So what I would do was get some scissors, sterile scissors, cut that part off. So now my wound is mostly, for the most part, it's dressed, everything's still sterile. So I would just cut that one part off. You're allowed 3 sterile breaks, but you have to identify them. So without dropping my hands below my waist, could drop this, garbage disposal. Well, not garbage disposal, my trash can. So now I'm going to go over, get my 4x4s. That's okay, alright. So my sterile field dropped, but it didn't cross over anything else, which is good. So, didn't break sterility with that other part. I'm going to pull them apart. Then I'm going to drop. Drop. Don't bother fixing it. If it's like way off, try to fix it, but like that, that's okay. I'm going to get my abdominal pad. That one just fell. That's okay. Blue to the sky, your blue line to the sky. Blue's always facing out. I'm going to cover the abdominal pad. Hit with the abdominal pad. Alright, wound is covered. Sterile part is now over. My gloves are now clean gloves. So, first thing I'm going to do is go ahead and get my tape. I'm going to window pane this dressing. So window pane means I'm going to tape right here, down to the top. Be nice to your patient, don't do that. But try not to be as aggressive. It's kind of a lot. Probably be better if I took it off like that. Alright, so once I'm done with that, go ahead and get a piece of tape, put it off. Alright, so then I forgot a pen, but I take a pen, write my initials, the date, and the time that I put the dressing on. I'm going to write on the table. I do not write it on my patient. Take it, place it right there on the dressing, so that now the next nurse knows when I changed it. Right, so now I'm gonna go ahead and take my gloves off. I'll dispose of all my supplies. So take that, depending on the solution, pour it down the sink, throw all my sterile field stuff away, because I don't need it anymore. Get it cleaned. Gotta take these gloves off because they're sweaty. So after I take I'll fix those. Alright, so wash my hands. Gonna go ahead and recover my patient. Alright, Mr. Antha, thank you so much for that. How was that procedure? How did you tolerate that? Alright, so now I'm going to go ahead, make sure the bed is lowered to the lowest position. Make sure he has the top one side rail up over here, the other top side rail over here. Leave the two down in the middle, down. So, right, that low locked. Here's your call bell. Your call bell is here, or over here on that side. Please let me know if you need anything. And I'm going to go ahead and get my tray table out of the way, throw away my sterile supplies, wash my hands, then go ahead and document. I document the approximation, so how well the wound is together, so it's well approximated, the color of the wound, and any drainage that I saw, the color of this surgical sponges I took off. Going to document the size of the wound. I'm going to document what dressings I put on, so the 4x4, I put some Kerlex with hydrogen peroxide on. I would say sodium chloride, which is what we're going to be using for checkoff. So sodium chloride, doctor ordered solution, and an ABD pad, which is an abdominal pad, and surgical tape on top. And I notice the odor of the wound when I took it. and how the patient tolerated the procedure. So after that, I'll wash my hands, document my findings, and the rest is just my uniform. So double check me on that. I'll double check myself when I review this, but that is how you change a sterile dressing. So let me know if you guys have any questions, and thank you.